Good afternoon. I'm Abid Zaidi and I am with Microsoft. I have here with me today Dr. Schulze from a brilliant startup called Lifetrack Medical. Thank you for joining us, Dr. Schulze.
Thank you, Abid. And you can call me Eric.
Okay, Eric. So I want to start off by really congratulating you as you're one of the 4 winners from the Emergex competition, which is part of our Highway to 100 Unicorn program that we launched here in the Philippines. We're really proud that you are on a journey with us, and together with you, we look forward to realizing Microsoft's mission, which we are talking about, which is to empower every individual and every organization on the planet to achieve more. Now, we understand that you're operating in a very important domain of healthcare, and especially in these times, we know how important it is to have the right healthcare infra and systems to provide adequate, and not only adequate, but affordable facilities to people at large. So with this, I want to discuss with you a few things, which would start off with, what caused you to think about coming up with a startup, what is the background, and tell us a little bit more about what your startup does.
Yeah, no, thanks so much. And I super appreciate Microsoft's interest in healthcare and the broader purpose and mission. Similarly, what started me on the path was I was here in the Philippines with my last company. It was a big teleradiology company that I grew, started in like 2004, 2005, ended up selling that in 2011 to a New York Stock Exchange listed company. And then I looked around and I said, what new thing could I do? And, obviously I'm a radiologist. And so, and one of the things that I had sort of pioneered was teleradiology. But as part of that, we ended up, having, a number of, healthcare professionals working with us, including, radiologists from around the world who we were basically helping train even. And it was sort of part and parcel of our software that we were able to actually upscale and build more radiologists. And so when I looked around and I saw, the following types of statistics, that 2/3 of the world, like the vast majority of the world, lacks access to basic healthcare imaging, right? Ultrasound or even plain film. 2/3. I was just stunned when I actually read that article, and I said that there's got to be something, wrong here. And so I started looking into it, and, living in the Philippines, because I had, moved this way to take advantage of time zones, doing night call in the US, but doing it daytime here in the Philippines. I realized that it wasn't lack of money. I mean, like here we live in the Philippines, you can see that the infrastructure is, getting better every single day, and there's tons of money with year-on-year GDP growth of 7% or something. It's not the money. And so then what is it? Well, it turns out that there's a lack of radiologists, right? So which, then like if you have a scarce resource, what do? Well, first thing you do is make it more efficient, right? The existing resource. And the second thing you do is to try and help build more. And so, what our software does is it provides an efficient, fast way to read cases, and deliver reports. And at the same time, we have a couple of patents. One of them actually helps train and test radiologists, but also helps them receive decision support as they're doing their diagnosis. So, we basically feel like we're sort of following a similar mission to basically bring healthcare, particularly imaging, to that 2/3 of the world that's missing right now. And the reason why we can do that is because we can both help improve the efficiency of the existing radiologists and, using the latest technology, and then, bringing help, basically helping train more radiologists, and doing that in a scalable way, not just sort of a traditional, residency method. So.
Makes sense. That serves as a very strong use case based on statistics that you just shared. Now, I think it's a no-brainer when it comes to kind of seeing how this solution can help population in general. What are some of the biggest challenges that you face as a startup? Because the solution makes all the sense, but what are some of the other challenges that you're facing, like in terms of, okay, it's a solution, training requirement, adoption, awareness of the people, and the willingness for these healthcare professionals to adopt a solution like this? Kind of
Yeah.
credibility that this solution carries versus some of the conventional solutions.
Right. No, it's a really good point. So, I mean, probably anyone who's looked into healthcare in any detail realizes pretty quickly that it's by nature pretty resistant to innovation and change. So, and I mean, it starts off with the Hippocratic oath of like, first do no harm. Well, change could do harm. Anytime you change, there's always the potential risk, right? And so in doing anything new in healthcare, that's certainly one of the hurdles that you have to overcome. And then second thing is, we're doing this in a market, in Southeast Asia, although we do now have, lots of customers in the US and even EU and Africa. The other piece of it is that you have to find, good IT talent, both on the development side and infrastructure side.
Yeah.
A lot of how we have architected our software is to help get over those things. So like we make sure that, we call it, we do the hard work to be lazy, in the sense of like, we know that we're not going to find someone at every small provincial hospital who's going to be able to handle setting up a VPN. So we basically make a software product that we can install like literally from a download on the site, that can help send images if they go to the cloud. We can also drop ship a server right to the hospital, so there's no need for the cloud component. And then we spend a lot of time working with our support team to help them help the IT person on site. So every step of the way we've tried to analyze cost, availability of technology and talent that and so we try and cut out the roadblocks to adoption as much as possible. So those are there's a lot behind that question, but yeah, I mean those are the main things I would say.
Right. Now moving on to, because as we discussed earlier, that micro as a tech company, we are making sure that we are playing a big role or noticeable role in this healthcare domain. But we do realize, even as a big tech giant, we still need domain knowledge, which we see startups bring into the ecosystem or into this equation. When you look at the Highway to 100 Unicorn program that we launched, what is it that you think is helping a startup like you? And then combined to this question, what are some of the expectations you would have from a program like this?
Yeah, no, I mean, so first, obviously Microsoft started as a software company, so there's enormous amount of experience that we can tap into that way. The other thing is, I mean, a lot of people don't know this, but I've worked with Microsoft in the past, and Microsoft is in every hospital. It is a major information system in every single hospital. So like one of the things that would be wonderful is to, work with Microsoft to figure out like, is there a way that we can work together to get our software in there as well, obviously. A lot of it is linking to other partners who are already out there in, let's say, like I mentioned that hospitals in emerging markets oftentimes don't have good on-site IT. And so one of the things that we're always looking for is a partner with an ISP who might potentially have what they call in the US managed IT services, where the ISP helps manage the infrastructure on site. Because that's like a no-brainer, right? You have hundreds of hospitals throughout, like thousands of hospitals actually throughout Southeast Asia. Most of them lack the underlying IT infrastructure to do to actually help with software that helps, democratize healthcare. So that's, those are some of the things. Obviously, experience and, meeting other companies that are, in this space and, distributors even like, software distributors, hardware distributors. So those are all the things. I mean, obviously, gaining recognition from a company like Microsoft helps us play in the, with governments. And honestly, it's funny, in one of the talks I once gave at a meeting, when there was a comment from the crowd, that basically one reason why unicorns don't come out of some countries is because the governments don't actually use the unicorns that are built in their country. So that's also an interesting thing, is to see if Microsoft can help us break down some of those barriers. Although here in the Philippines, we are starting to get government contracts. So.
Right, makes sense. And I think, as you mentioned, talking about technology, how cloud technology can really serve as a right platform for you to expand into some of the territories where you don't have physical presence or IT support that you require, let's say, conventional solutions. So that is something which cloud makes possible.
Yeah, absolutely.
Now, when you look at 12 months from now, or 24 months from now, with this pandemic, keeping that into perspective, what are some of the growth opportunities that you, as a startup, are looking at, and how would the technology play the role for you to kind of really set you up for success in the coming months?
Yeah, no, it's actually it's a great question. I mean, the pandemic obviously, short term hurts, right? People aren't going to hospitals. It's an odd thing, right? COVID patients are going to the hospitals, but the census overall in places like the Philippines during the peak of the quarantines, like 30%, like that's deadly to a hospital in most environments. Like you have to have a census that is not 100%, but you don't want it to be 30%. You want it to be 60 to 80%. In the US, to be profitable, it's somewhere around 80%. So COVID basically in the short term, caused issues with people just not doing as many cases. So revenue decreases. But on the positive side, if there is a positive side to something like this, I mentioned earlier that healthcare is very resistant to change, and just going digital is a big change for many, hospitals here. And yet COVID hits, and all of a sudden everyone wants to work from home, right? Well, healthcare, being so behind the times, was kind of left out, right? How are they going to work from home? Well, the companies who were already using our software, they had no problems. They basically said, okay, log on to the, to your work list from home. That's one of the things that we do that is, the legacy systems don't do, is allow you to have the same workflow wherever you are, on site, off site, on the cloud, wherever you are, right? And so for us, the companies that were using us already, they were like, didn't miss a beat, right? And we have, recently, now that things are starting to, open up a bit, and people are starting to realize that, with vaccines that the economy will bounce back, they're starting to realize, we should really rethink our digital, our move towards digital, particularly in something like radiology, where like most of the people who are doing it don't have to be on site. So it's actually, we've had a number of people approaching us saying, hey, how soon can we, get on using Lifetrack so that we can, have our radiologists work from home.
Sure. So this, what you're doing is extremely exciting, Eric, and we are extremely happy and proud to be working with a startup like yours. We've got a long way to go with Lifetrack.
Thank you.
On the journey with Emergex and Highway 200 Unicorn. I really look forward to that strong partnership, and I hope that in this journey we are able to really come up with those solutions which are really needed by the people, and especially this women is so important in these times. Bringing affordable and adequate healthcare is extremely important. And I think your solution is really it's really going to make a difference, right?
Yeah.
So with this, Eric, thank you very much for taking the time out.
Yeah, thank you, Abid. I super appreciate the time.
Yeah, and look forward to an exciting journey with you, Ed.
Yeah, no, thanks so much. I really appreciate it, and thank you.
Thank you. Take care.